Chronic obstructive pulmonary disease, COPD, is a progressive lung disease that primarily affects a person's ability to breathe. It's characterized by chronic inflammation of the airways and lung tissue, leading to obstruction of airflow. The two main conditions that fall under the COPD umbrella are chronic bronchitis and emphysema, both of which typically result from long-term exposure to irritating gases or particulate matter, most commonly from cigarette smoke. Here are some key points about COPD. Causes. The primary cause of COPD is smoking, including both active smoking and exposure to secondhand smoke. However, long-term exposure to other lung irritants like air pollution, chemical fumes, and dust can also contribute to the development of COPD. Symptoms. COPD symptoms usually develop gradually and worsen over time. Common symptoms include persistent cough, increased mucus production, shortness of breath, especially during physical activity, wheezing, and chest tightness. Diagnosis. A diagnosis of COPD is typically made based on a combination of medical history, physical examination, lung function tests, spirometry, and imaging, chest X-rays or CT scans. Spirometry measures the amount of air you can exhale forcefully after a deep breath and helps assess the severity of airflow obstruction. Stages. COPD is often classified into stages based on the severity of airflow limitation. The most commonly used system is the Global Initiative for Chronic Obstructive Lung Disease, GOLD, system, which categorizes patients into 4 stages: mild, moderate, severe, and very severe. Treatment. While there is no cure for COPD, treatments are available to manage symptoms and slow disease progression. Treatment options include bronchodilator medications, inhaled and oral, inhaled corticosteroids, pulmonary rehabilitation programs, oxygen therapy, and lifestyle changes such as quitting smoking and avoiding lung irritants. Complications. COPD can lead to various complications, including respiratory infections, pneumonia and bronchitis, exacerbations, sudden worsening of symptoms, and even heart problems due to the strain on the cardiovascular system caused by inadequate oxygen exchange. Prevention. The most effective way to prevent COPD is to avoid smoking and exposure to lung irritants. If you smoke, quitting is the single most important step you can take to protect your lung health. COPD is a chronic and progressive disease, meaning that it worsens over time. However, with proper management and lifestyle changes, individuals with COPD can lead fulfilling lives and better manage their symptoms and quality of life. If you suspect you may have COPD or are experiencing symptoms, it's important to consult a healthcare professional for proper diagnosis and guidance.